Welcome to The Explainer. Today, we're getting real about the modern epidural. We are going to cut through all the noise, all the myths, and give you a really clear, reassuring guide to what has become a major part of modern childbirth. Here's what we're going to cover. First, what makes today's epidurals so different from the ones you might have heard stories about? Then we'll get into the science of how it actually works. We'll walk through the safety plan step by step, tackle those common myths head on, and talk about your role in the whole process. And finally, we'll frame this as what it is, an empowered choice. Okay, let's dive right in, because what we're really talking about here is so much more than just a method of pain relief. Seriously, it's about a fundamental shift in the birthing experience itself, one that literally moves you from being a passive patient to being an active, engaged participant in your own delivery.
This right here is the core idea. We have moved way beyond just a simple numbing agent. Modern medicine now offers this incredibly precise, balanced tool that allows you to be rested, focused, and totally ready to push, rather than just feeling like an observer.
So how in the world does an epidural actually do this? How does it selectively block that intense labor pain while, still preserving your ability to move and feel the pressure you need to feel? Well, it all comes down to this really cool concept called the differential block. The magic, the secret sauce behind the modern epidural is this differential block. It's not about just turning everything off, not at all. It's a selective, super targeted approach. And this is how you can experience incredible comfort without that feeling of complete numbness. And I love this slide because it shows the difference so perfectly. Think of your nerves like they're electrical wires of different thicknesses. The low-dose medication, it acts like a filter. It's just strong enough to stop the signals coming from the thin pain wires, but it's not strong enough to block the thick motor wires. So the sharp bite of pain gets filtered out, but that important feeling of pressure and muscle control, it gets right through. Okay, so let's move on to the actual procedure and see how this works in practice. Every single step is meticulously planned out. It's all designed with your safety as the absolute #1 priority. This is not guesswork. It's a very strict, evidence-based protocol. These checks are seriously just like a pilot's pre-flight checklist. Before anything even begins, we make sure your platelet count is safe to prevent any bruising. Then we give a tiny test dose for 100% confirmation that we're in exactly the right spot. And hey, if the relief feels a little uneven, we use simple things like gravity to fix it. Every condition has to be perfect before we move forward. So you might see this number, 20%, and wonder what that's all about. Well, think of it as our safety guardrail. Look, a slight temporary dip in blood pressure is actually expected as your blood vessels relax, but we monitor it constantly. If your pressure drifts more than 20% from your baseline, we can correct it instantly, often before you even notice a thing. All right, now let's address some of those common worries head on. A lot of fear comes from stories, right? Things we've heard from family or from outdated information about old procedures. So let's replace those fears with the cold, hard facts of modern epidurals. A really common concern is the effect on the baby, but the reality here is so reassuring. The epidural space has this incredibly effective natural filter. The amount of medication that actually reaches your baby is mathematically minuscule, and studies confirm it. There's no difference in alertness or breastfeeding success. Okay, that heavy, cold feeling in your legs, it can be really unsettling, I get it, but it is not a sign of damage. It is simply a sign that the medication is working exactly the way it's supposed to. Just think of it like your arm falling asleep when you lean on it for too long. It's a temporary sensory thing that goes away completely a few hours after delivery. This is where that low-dose technique really shines. You absolutely will feel the pressure that guides you when it's time to push. And as you get closer to delivery, we can even adjust the medication to enhance something called the Ferguson reflex, which is your body's own natural, involuntary urge to push. Pretty cool, right? Let's be super clear about the anatomy here. The needle goes into the epidural space, which is outside the spinal cord. It never enters the cord itself. Any soreness you feel at the spot is temporary, kind of like a muscle ache. Long-term back pain, that's almost always related to the huge physical strains of pregnancy and new parenthood, not the epidural itself. So while the medical team is constantly watching all the objective data on the monitors, you are our most important guide. Your feedback is absolutely critical. So let's cover exactly what you should tell your team to make sure everything is just perfect. Now listen, none of these are signs of danger, okay? But they are really important signals that help us fine-tune everything. If the pain relief feels uneven, if you get a weird metallic taste, feel a heaviness in your chest, or just get the shivers, which is super common by the way, just tell us. Each one has a simple adjustment we can make for your total comfort and safety. All right, so let's bring it all together. When we look at the precision, the science, and all these safety protocols, we can really see the big picture of what this medical advancement is truly offering you.
This number, 95%, it isn't an accident. It's the direct result of all those strict, evidence-based protocols we just talked about. It represents an incredibly high standard of reliability and safety in modern maternal care.
So ultimately, this choice isn't about avoidance or taking an easy way out. It's about choosing a medically supported tool that can let you experience the absolute joy of birth without the trauma of unmanaged pain. It's about being rested, present, and totally in control of one of the most powerful moments of your entire life.